Chronic obstructive pulmonary disease, commonly known as COPD, is an inflammatory lung disease that makes it difficult to breathe. It does this by changing the structure of your lungs and how they function over time. But to get a better idea of this change, let's take a look at healthy lungs. These are your healthy lungs. You breathe in oxygen that travels down your trachea, commonly known as your windpipe, and this windpipe tube allows oxygen to pass to and from the lungs. After the oxygen is breathed into the windpipe, it flows through two other large tubes known as bronchi, which lead into your lungs. Once inside your lungs, these two tubes section off into many smaller tubes called bronchioles, similar to branches on a tree, and each branch ends in a group of tiny air sacs known as alveoli. The walls of these tiny air sacs are lined with capillaries, which are the tiniest blood vessels in your body, and these capillaries can be viewed as bridges between the lungs and the bloodstream. So, when you inhale and the air reaches the alveoli, your capillaries allow the oxygen to cross from your lungs into your bloodstream. But at the same time, carbon dioxide, the waste product made from your breathing process, is allowed to cross from your bloodstream into your lungs. So, once you exhale, the carbon dioxide passes through the lungs and out the body. This is a continuous process for healthy lungs because they have a natural elasticity similar to a rubber band when stretched and released that allows the breathing process to function smoothly within the lungs. Now, let's look at how COPD changes how lungs work. Lungs with COPD are different. COPD lungs are not as elastic as healthy lungs due to destroyed lung tissue and mucus buildup. So, the tubes and the air sacs in the lungs overexpand and don't bounce back as quickly when you breathe in and out, which causes less oxygen to get into your body and less carbon dioxide waste to get out of your body. This can cause shortness of breath, fatigue, and frequent respiratory infections, making it difficult for you to live a normal, active life. Long-term cigarette smoking is a primary cause of COPD development, as well as exposure to air pollutants or workplace fumes. So, quitting smoking or limiting pollutant exposure is an actionable first step you can take to help you manage the effects of COPD in your lungs and improve your quality of life.